Hi, I'm Dr. Michael Lukens. I'm a clinical psychologist. I've been treating people with addiction and addiction-related problems for a couple decades. I want to speak to you today about a couple ideas that I have about relapse prevention. If you've been struggling with an addiction or addiction process, you understand how important relapse prevention is. So why do so few addicts have a successful recovery? It's because they don't fully understand the challenges involved in preventing relapse. So the question that emerges there is, well, what is it that motivates people to slip or fall or experience a full-blown relapse? So we talk about the idea of triggers. If you don't know what your triggers are, then you're going to trip over them. They're going to get the last word in your process. The other thing that I think is important is the issue of trance and trance phenomena. If you've struggled with an addiction for a while, I think you understand what it is that I'm referring to when I use the expression trance. Somehow you go into a state where it's as if somebody takes over your body, takes over your mind, and gets you to do things that you know in your rational state you don't want to do. So how does this happen? I can explain that to you. It's pretty complicated. It has to do with some neuroscience. It has to do with levels of awareness. But just understand this right now. If you haven't analyzed your triggers, you don't understand them, and you don't recognize the role that trance plays in your challenge and in your recovery process, then you're at risk. So I'd like you to tune in. I'd like you to hear more from me about this. I have a lot to say. I think it will benefit you. Thank you.